Well, thank you for that introduction. That is a very comprehensive introduction. So thank you very much. Before we get started, I wanted to also thank the Leslie Group for having us present this, I say, well-needed topic for everyone's benefit. So we wanted to make sure that we thank the Leslie Group and everyone that had everything to do with this presentation today. So without further ado, why don't we get started today? And I'll start out by saying I'm going to ask some probing questions at the beginning of this presentation, and certainly leave some time to get some responses to those questions. But I guess today is really supporting how an organization should look at this problem, which will then dictate how we then proceed on how to deal with these issues. So I would say that without further ado, let's get going. So introductions, I won't spend time on our high school pictures here, but the Leslie Group has provided us with a great introduction. Allison has been a newer member to our team as of almost a year and a half, 2 years ago, and has a tremendous impact with our client base. And I certainly am the founder of our advisory practice. And the unique part of this is a lot of the origins of our practice start with an executive strategic view on this topic. So that's why kind of I hold two hats today. So I wanted to first start out with a quick overview of who we are as an organization. Some of you deal with us, some of you may not deal with us, but generally speaking, we're in the business of reducing avoidable absenteeism. And we do that through the wide range of services we offer. But we offer those services to our employers in a capacity of these kind of silos of prevent, respond, return, and really looking at organizing what we do in each of these really key areas of helping with absenteeism to, one, prevent them, respond to them, and get people back to work. So I won't get into too much detail about all the different services we offer. They are shown on this slide, but really we're just not a service provider. We really have an impact to help organizations with compliance and absence management throughout Canada and into the US. So let's get right to it and give you a quick overview of what you can expect today. I think this grounds a bit of the conversation that we're about to have. So we'll get into some workshop type material. One is, what exactly do we mean by absence management? Because there's a lot of terminology out there: disability management, presenteeism, absenteeism. We want to really clarify our language so we can talk the same language. Next is, I'll ask some probing questions of the group, and these questions are for the audience. They are questions that you should provide some sort of thought. And if you can, write down answers to those questions for your organization, and certainly share them in the chat. We'll get into why I will say traditional current methods some organizations use really doesn't work, and really make sure that we understand what then does work. That works to the point where we yield the results we want out of the program. Spend a little time on a case study and then get to your questions and answers. So that is a quick overview of what you can expect today. So let's get into it. I mean, what is absence management? Many people answer this question differently. Some answer it with, well, we have a policy. That's what absence management is, or we have a person. But really, is absence management, the pure definition, it's the employer program. All components of the employer program that really is there to support everyone when they're not able to work, sick, injured, whatever. It's both occupational, non-occupational type absences. And part of an attendance management program or an absence management program is, what are we doing to help employees when they are at work or not at work and need to help them with things like their own personal health? So wellness programs are included in this conversation. Really geared towards supporting early return to work. And we really want to control absences due to injury or illness. So that is the definition. It's an employer program. It's not a policy or an individual. It's an organization's initiative. And I think we need to clarify one thing as we talk about what an absence management program looks like from specific components. So usually we look at, we should think about absence management with all of these components. Right from the, I'll start at 6 o'clock and go clockwise real quick, but yeah, you better have a position on absence management, as we always look to making sure that when we think about absence management is what are the policies? How do we think about it? Then we get into case management. How are we dealing with people? Who's dealing with them? Insured program, uninsured program. Ensure privacy and confidentiality is maintained throughout absenteeism in the organization. How does culture impact it? Are we tracking and measuring absenteeism? How are we providing health and wellness to support people? What does the absence plan look like, from the short to casual to LTD to workers' comp? What does that plan look like, and how does it impact absence management? What are we doing to make sure that we have an evidence-based practice to support people when they're off? Are we educating our frontline supervisors? What do they do? And in some cases, what don't they do when dealing with this topic of absence management? And lastly, is it understood to the point where everyone has clear responsibilities and accountability to the performance of the program? So that just gives everybody a quick overview of when we talk about absence management, this is actually what we're talking about. And I think it's really important to look at it that way. Now, let me provide another clarifying definition. This is a WMC, a workplace medical term that we use in all of our language. And the goal in most organizations is to reduce absenteeism, but the one we want to focus in on is the avoidable type of absenteeism. And the difference between avoidable and unavoidable absences is the avoidable ones are those absences that should not have happened at all due to gaps in process, policy, approach, etc., or they actually lasted longer than they needed to. That is the goal of absence management. This is what we want to contain the risk of. So this is where I'm going to ask everybody, just with those quick definitions on what an absence program looks like, the components of it. So I want to ask very specific questions of this audience. And again, don't scream out and answer them now. We'll get to some of the way you answer them, but it gives you some food for thought. Look at your organization and ask the following questions. Do you actually know what absenteeism is costing you? And I mean all absenteeism. Casual sick costs, STD, LTD, workers' comp, and other direct costs that impact absenteeism, like overtime premiums to pay people those that are off. So that's question number one. Give it some thought on do you actually know, or can you actually estimate what that cost is? Two, is absence management a strategic priority for your organization? And the definition of a strategic priority is it's a priority that is at all levels of the organization and in every department. And the performance is tracked the way you think you need to track attendance and absence management. Three, are you asking for the outcomes? What kind of outcomes do you want out of this? The last question is, what are your roadblocks currently that are preventing you, or their challenges to get on top of your attendance and absence management challenges? So I'm going to leave this up for another couple seconds here. So if everyone wouldn't mind, is take these questions down and provide some thought and share your response towards the end of this presentation. And it'd be really interesting to understand from this audience the responses that we will certainly share with everyone. So let's move on to some facts and fundamentals. This is kind of what we know on how we frame absence management. You can see here the first fact is how costly this is, and it's a conference board study back 5-6 years ago mentioned a $16 billion problem to Canadian employers. It's grown past that point over the past 10 years. Two is think about it from the direct cost of absenteeism. Is that same study said that the average cost is around 2.6% of your payroll. And again, when we talk about absence costs, we talk about the direct costs associated with providing that absence benefit. A casual program, you get 10 days paid a year, you have an STD program, an LTD, and we're covered by workers' comp. It's the aggregate of all that information. And another thing is the average absence rate expressed in terms of how many days the average employer takes off due to illness or disability. It was 9.5 days in 2020, up 2 days from 2 years before that. So really important thing is we know that absenteeism is impacting the amount of time employees are not at work. And if COVID did anything, it really exacerbated that. Two is we know that absenteeism is lasting longer. And a big driver of that is the growth and incidence of mental health in the workplace. So quick stat here is 10% of the labor force is living with some form of a mental health condition, which is a 31% increase from 2018-19. That comes from the Mental Health Commission of Canada. A third factoid is companies that have great success in their absence management program measure the cost, actively measure the cost, and track absenteeism at the supervisor level right up to the P&L of every organization. Unfortunately, this fact is only 15% of Canadian employers track statistics and costs associated with absenteeism, to which I would say, well, you can only manage what you measure. And if you're not measuring it, then that is one significant gap that we all have to internalize. And lastly is attendance and absence management is affecting the productivity of our workforce. So again, a stat is the Canadian labor force ranked 14th amongst all developed nations for the number of GDP hours worked. So it's a reflection of how we rank and how effective our productivity is amongst GDP of a nation. So Canada ranked 14th. So we're not at the top, certainly not at the bottom, but it just shows you that it impacts significantly the productivity in our workforce. So it's not just about the absence cost, but it's now the indirect cost of productivity, culture, and morale, absenteeism, especially when it's unmanaged, has on an organization. So what do these facts mean? One, we know that if that is how we frame and define absence management, it's not just an HR issue. It's an organization-wide issue. It comes with risk factors associated with financial, organizational, legal, cultural. So if that's the impact absenteeism had, that's not just a tactful issue inside of an organization. Two is we know it's going up and we know it's affecting the bottom line of most organizations. Three, it's becoming harder and harder for organizations to manage this throughout the organization. Lastly, is this issue cannot be fixed by just giving supervisors and managers more training. This is not where this problem's fixed. It's much bigger than that. So what do we conclude with these facts? Is this is a strategic priority. This is a risk management issue for all organizations. Remember, the biggest cost we have as organizations is payroll. Absence management is a productivity factor of our payroll, of our human capital, and it needs to be measured as such. So I'm going to skip to this next slide, which really frames why are some organizations just not getting the results they want out of it, meaning lower costs, lower incidence, better engagement. What's standing in the way of getting kind of those types of results? And this may be what you're currently feeling inside of your organization. But most organizations think of an absence program and they immediately turn to saying, if we just were able to fix our abuse, that would really, Joe's always not here on Friday. And if we really fix that problem, we really got something going. And that can't be further from the truth. So I want to dispel a myth. Abuse is not the biggest problem inside of an organization, but it is one. It's one of many. Second one is there's a lot of problems of why we have absenteeism that's growing and maybe unmanaged in our organizations because we don't have a consistent approach from the frontline manager who has that relationship with the employee. Every manager may deal with absenteeism a bit differently or not deal with it at all. And we find that a lot. The next thing is we just don't have any good control or visibility over what absenteeism is. That really speaks to why we ask the question, can you measure it? Are you currently measuring? Is it something that is important enough to measure and then manage inside of your organization? Next is your program may have some gaps in it. That's why you have growth in attendance and absenteeism. And lastly is we just don't know. We don't know what ails our employee base. We don't know what kind of supports they need. So we don't really know how to respond to our employee base. And you see a lot of that in organizations that offer wellness solutions that don't actually use information that they can gather from them to help their population and structure good employee wellness programs. So what this really says is it doesn't come from one source. It comes from all of these. And the goal is we got to get to the bottom of where these gaps are in every organization. So a bit of a checklist for everybody. And while I'd like to be able to see everyone's hands with this slide going up, this is a list, an aggregate list of what we typically run into when we help organizations with absence management. Is the first question that comes up is we get symptoms of an underlying greater problem. Costs are going up. Really, senior leadership, there's a disconnect between what they want done and what's actually happening on the bottom line and in the front line, excuse me. We always find this as managers sometimes just don't want to deal with this. Like I know Joe, he's a friend, and I don't want to get involved in this, or they're not prepared to deal with this. There's no accountability. Absenteeism is happening, but no one's truly accountable to turn it around. Inconsistent guidelines, little tracking, little training, and a siloed approach. And this is very evident in some employers. They deal with attendance in a siloed manner. And what that means is, well, if it's a workers' comp injury, then you kind of go down door number one and go speak to Susan. Hopefully there's no Susans in the crowd, not to give you more work. Second is, if it's a non-OC or a short-term, then you go down, and this is the process for that, where they treat absenteeism very separately. But at the end of the day, it doesn't matter whether we get hurt at home or at work. We still have an employee who's not able to attend work due to illness or disability that needs support and should be managed the same way, irrespective of whether it's OC or non-OC. And lastly, and this is, I can probably speak for you all, is employees think of this as a sense of entitlement, is stop asking questions on why I'm off. I just need to be off and accept this. So what this does is I probably see a lot of hands going up going, yeah, we have some of those symptoms inside of our organization. So what most organizations do, again, still within that header of how we see current organizations deal with this, is they try to self-diagnose. And we see this a lot, and it's very persistent. One is we think we need better rigor. We need everybody involved when people are off work. So we need to get a hold of the employee sooner, or we need to ask for more information. Two is you think that it's getting more complex and you can't do anything about it because it's more complex. There's a limitation of what information we can have access to help that employee return to work early and safe. And lastly, when we try to diagnose this, we look at this and saying, well, we just probably need better intervention when people are off work. We need better case managers. We need to do more when people are off work. And in that diagnosis, what typically comes out is, well, maybe we need to shop our benefits around. And that the Leslie Group, certainly a professional services organization that does this, is sometimes it's very hard to do, especially when your performance is not great. Another Band-Aid solution that we see used is we continue to start asking for more doctor's notes. This is a really popular tactic employers take. And there's a role for this, of course, but it's a popular tactic. Let's ask for more medical information. Let's talk to the doctor. Lastly is we want to think of just changing policy. Maybe a policy change could have an impact. And lastly is we kind of push a problem down, and I'm not saying this is everyone, but we push a problem down into the supervisor group saying, hey, we noticed that, you should be dealing with this a little better. So here's a little training session, or maybe here's a little tool, and maybe you need to talk to your people more so. So we look at this list of what we call tactical and Band-Aid solutions. And I wanted to spend a bit of time talking about a survey that was done. And it's really about doctor's notes. In this survey, Canadian doctors, probably done in 2015, 822 doctors across the country were asked a single question. What fraction of your patients with a condition that's not work-related and who have asked for you to sign a form excusing them from work really need to be off for medical reasons? And I unfortunately, what I'm going to report through the survey is less than 10% of those doctor's notes those patients did not deserve a doctor's note. So it shows you that those tactics have little impact. You're gathering bad information in, which leads to bad outcomes. So I thought to share this with you as part of this explaining kind of what we see that doesn't work too well, and summarize it with this slide and saying, you know, what we typically see most organizations and how they behave is we see a trigger in cost. That's usually a driver. Either costs or statistics are going up. So that means STD premiums or LTD premiums or workers' comp premiums, they're starting to rise or it's getting worse. It's beginning to have an impact on the organization's ability to deliver their services, products, et cetera, and organizational goals. And we've kind of run out of Band-Aids. The Band-Aids really aren't working. And what that says is we're not really dealing with it strategically. So we really want to paint the picture and saying, well, what the heck does a strategic approach look like? Well, with any strategic initiative, we really hammer down 4 basic components. Any initiative, buy a new plant, move it, hire more people, invest in whatever, is we first understand what the underlying issue is. So research the issue. 2 is, what do we want out of this issue? What are the intended outcomes? Let's create a plan and let's make sure we implement and govern this plan right. This is what a strategic process looks like. But when you apply it, when you really apply it to an organization, it really gives absence management a strategic, holistic look. It touches everywhere in the organization. So absence management is not a person that's in the HR that's there alone dealing with this problem. It's everybody's responsibility. It's operations responsibility, it's human resources, and it touches every part of the HR division.
Angelo, I'm just going to interject for 1 second because you made a comment and a couple of people have asked the question around that troubling issue of doctors signing off on workers who don't really need to be, that this is something that's troubling them. I can tell they're looking for what's the answer to that problem. So I just raise it now so you can incorporate that in as you move forward.
Yeah, I'll deal with that issue when we get to it. Yeah, thanks for letting me know, Allison. Thanks for those questions. Yeah, it is very troubling. It really highlights one challenge that we all have when we only use doctor's notes to manage our programs. But I'll delay answering that question because I think the answer lies in the next few slides. What does a strategic perspective look like is we want to first look at a problem and saying, what future state do we want? Do we want attendance to be the same, go down? What should our costs be compared to our peer groups? Get a roadmap as to how we're going to get there. 3 is this roadmap really structures and holds everybody in the organization accountable to dealing with attendance. And when we make this a strategic issue is we assign accountability for outcomes, not just responsibility of tasks. And we make sure that when we create this approach, we want to make sure we see some risk barriers, things like union reaction to a change, perhaps. And lastly is we want to make sure that any plan we create, again, back to what makes it strategic, is we have to really execute and govern well. So here's the big slide. You know, what does a strategic framework look like for attendance problems? It's not to go in and deal with a doctor's note issue right in the front end, while that is an important issue. But phase 1 is really an important step that we call investigation and audit, is what are we looking at? Let's look at talking to your people. Let's look at your current practices and policies. Let's look at where gaps are, and let's begin to quantify what absenteeism is costing you compared to your peers. Phase 2 is a roadmap. Phase 3 is implementation once that roadmap has been approved and we begin to implement and govern this plan. Now, real quickly is an audit is what I described it. Is it an attendance audit? It provides all gaps inside of your program to allow us to build a plan. And one of those gaps is, are we relying too much on doctor's notes? And what can we do about them? And I'll get to that in a sec. Second step is, once we have an idea of what we're dealing with here and how we've quantified this, is we want to really get down to what do we want to do with this and how do we want to change our program? What are the goals? Where do we want it to go? How do we want to reduce absenteeism? What are we going to work on first based on the recommendations from the audit phase? And last stage, which is done quickly, or is done over time, is implementation of the recommendations over time and making sure we're getting the results. And those results are better employee and engagement, better enforcement and consistency of absence policies and procedures throughout the organization, ensuring that we're supporting people when they're off work, and making sure we're getting those outcomes of reduced absenteeism and the related costs. So I'm going to spend some time talking about a case study here, and I want to share this case study because I think it's really, really important by way of experience. And again, this is actually a client that we're currently still engaged with. It's a public school board. It's the Hamilton Public School Board. And back in 2017, they had the audit, Governor General Audit, revealed a real troubling trend. 72% increase in sick days over 5 years. The average number of people that missed, the average number of days missed per year was 14.4. And that's still, that was still growing. So it got as high as 15.4. And really most importantly, 5 more days off. The peer group average was closer to around 9 or 10. So they were 5 days over the peer group average in the school board sector, which is very troubling. So we got involved and did an audit, and what we discovered was that traditional tactical approach was being used and wasn't yielding results. So they wanted to hire more staff, they tweaked some policy, they asked for more doctor's notes to validate absences, and they put pressure on the frontline managers to reduce absenteeism without much training and support. So it was really impacting student success. And what that means, as every organization has outcomes, is graduation rates were dropping because teachers were not in classrooms. When teachers are not in classrooms due to absenteeism, they get negative results on student success, graduation rates and passing grades. So we got involved with an audit. We really got involved with this audit, and we saw big gaps. And those gaps were antiquated policies, a real siloed approach, and the lack of this being an important metric inside of the organization. So it was actually bigger than they thought. We prioritized we created a business case for them to essentially present to their organization that talked about how we were going to turn this program around. And it had 11 key recommendations with all the things we want built into a recommendation set. And the roadmap was a 5-year roadmap. And the goal, the outcome was difficult to put in place, but we have overwhelming success here. But the goal was to reduce absenteeism by 0.5 days per employee per year. That was the target. And before I leave that target represents around $500,000 per half day cost savings to the school board. So we have successfully implemented this program year 2 into it, and now we're backing away and getting out of it. And what we have here, happy to report, is this was a strategic plan supported by leadership. What was buried and included within their 5-year board plan on operating their business. It became a key metric in operations. So a real success story. So in 18 months post-implementation, which was 6 months ago, outcome 1 is increased employee engagement and student engagement. That came out of their evaluations with employees. 2 is they experienced a lower level of absenteeism quickly. In the first year, we reduced it by a day and a half. And that day and a half exploded to 4 days quickly. And we estimate that produced about a $3 million cost savings to the board. So it's changed the trajectory. It's going down, and they're beginning to redistribute those savings to other programs, which include wellness. Second to last outcome is they're now at the point where they have an interactive employee wellness program that they know is going to continue to support their level of absenteeism and their employees while they're off work. So they're currently in the process of launching that. And more importantly, I would say, is great success in that we have a reduction in absenteeism and cost, but this is now integrated within their annual plans. Is what's our goal going to be this year? What's it going to look like this year? What does the program need? This is a quote that I'll share with you from the director of this board. And I think what this essentially says, and I'll read it real quick, is the audit was a bold undertaking. It didn't take long for us to, one, build that trust with them, to be critically frank with the current state and get them on board to the right direction. So let me touch on one thing, and that's the question that I believe some of you have asked, is, how do we deal with these doctor's notes? And the tact that the response we have is, if you're going to get medical information and ask for more information to support any absence, whether it's OC or non-OC, is the effectiveness is to have a treating physician speak to an occupational health physician who you may have in your organization, or you may provide through other organizations, as certainly we do, is when a disability case manager asks for that information from a treating physician, you're going to get that 90-10% rule come back at you at a low priority, which will take time. And the first problem is, since it'll take time to get that information, the absence is just lasting longer than it should. But what we find successful as a tactic to deal with doctor's notes is to support your organizations with occupational physicians that can actually speak to the doctor and saying, hey, got your doctor's note. It says 6 weeks off for medical reasons. Can you kindly provide some information? And what inevitably happens is we really find out whether there's a medical issue or not, two, and whether there's an HR issue as well. And we predominantly find that sometimes they're not just medical, or they're not medical at all, but they're turning into medical issues. But in fact, we can then report back to the employer and say, we've talked to the doctor, we've gotten his attention, and this is not a medical absence. It's actually an HR. They don't like their boss shift time. We think this now needs to be a labor issue. So we're able to really deflect, get real critical information. And that's what we call evidence-based disability practices. And again, I don't want this presentation to be a tactic on dealing with that on its own, but that's a very, very important tool that we make sure is used, not all the time, but in cases that require an evidence-based approach to either validate a medical absence or not, which usually is then supported by an HR matter. So I hope I've given some credit to answering that specific question. But I think now I'd like to get Allison to provide some feedback, and again, within the chat, on the poll questions that I had, and any other questions that have come up. So I'm going to actually turn it over to Allison. So Allison, if you don't mind, hit me with your hardest questions that you possibly could have.
Yeah, I think the first question generates some thought, Angelo. When we talk about, do you know the costs and what's included there? The request to talk a little bit about that financial analysis. How do they go about it? As we know, when we go into organizations, they rarely can answer this question with a resounding yes. We know, we've been tracking it. And the first thing they start to do when we ask them for that information is, well, where would I even look? Can you talk a little bit to what you would expect to receive from an organization to answer this question, and how they can go about doing it?
Yeah, absolutely. I think, the first thing is, when we ask a organization to consolidate this information, it's very challenging because they don't typically track it. What they do track and get is the occupational side, workers' comp, in each of the provinces. They do a pretty good job at sending you a bill at the end of each month or quarter. So they know that cost. Most organizations have a really good idea of occupational health costs. And that's really important because it's an actual bill that someone has to pay. And on that bill, usually talks and provides information on how the performance of the program is. But when it comes to non-OC and STD, if it's an insured plan, yeah, there's a bill too. But if it's part of the casual part of an absence is where an employer has, I'll give you an example, and the people on this call may have this kind of a setup where they provide payment for absences for the first 5 days or 10 days, and then it may roll into STD. Is we don't really capture that information well because it's just usually buried in the payroll cost. So that's a very difficult thing to get. And it's certainly attainable, but it is a cost of absence. And I like to say is, from an accounting perspective, is most payroll departments or accounting departments, when they pull a performance, a profit and loss statement or an income statement, there's no line that says absence costs. Why? So it's almost like a hidden cost for more organizations. So to answer your question, how do we get that information? Is we do our best to ask for it if it's being tracked. And sometimes we have to estimate it based on statistics and usage, if an organization is tracking it. Two, when we consolidate that information and we want to feed it back in the point where we can say, here's your absence cost, and here's what your peer group's absence costs are. So you can get a relative view of how you perform amongst your peer group.
Thanks, Angelo. I think that was very, I guess we wanted a general. We don't want to get too specific. And that was, I think, from all the questions I saw here on cost, that's a good guideline. I have a specific question. And I think a lot of union groups, employers come up against this, smaller to mid-sized organizations come up against it as well. And that is, how do you implement these kinds of initiatives around disability case management where you're not offending the employees so they don't become defensive? And what they're really getting at is when you try to go after an employee about reasons for why they're absent, you can come up against a wall. So how do you deal with that?
Well, that usually, so I'll start to answer that question for everyone, because that usually comes from the world where employers pick and choose and don't implement their absence policies consistently and start dealing with different absences differently, or sorry, the same absences differently. So unions, our experience with unions is, I would say, consistency. To understand why this could happen is we need to make sure that our policies, and if it's an attendance support program that sees you have a first level interview with an employee, as an example, after 5 days of absences that aren't accounted for, is we really want to make sure that we're not looking at individuals, is that we're implementing a policy consistently. So it's not a specific initiative for this employee because we think we know that he doesn't like showing up on Fridays before a long weekend. So I would say the reason that could possibly be happening is we're not implementing our approach correctly. Secondly is you have to engage the union in this conversation. In the case of the Hamilton School Board, because they weren't implementing their policies consistently, the unions began to question everything because it was viewed and perceived that the school board was picking and choosing their battles. When we actually consistently applied our policies, and they were articulated to the union as part of the audit phase, which is what we included them in part of that audit phase, is they were quite happy that consistency ruled, that this wasn't a way to just terminate employees, that there was a consistent policy that was applied to everybody, that a union can stand behind with their union base.
And so I think just tying it into sort of the non-union response, it ties in with another question that's come up around our experience. As valued as the Hamilton Wentworth District School Board is, many of the clients on the call today have smaller organizations, more intimate teams, and a lot of people wearing multiple hats. And so the question is, do we have experience working with smaller organizations who are addressing this issue? And I think that ties into the earlier question around, it's not a union problem, it's that I'm friends with my manager, or I'm dealing with an HR team that wants information I don't want to give them.
Yeah, absolutely. Absolutely. The bulk of who we work with is these smaller employers, and that's a really important. It's a really important item for us because our goal is to keep Canada working, generally speaking. And just because we work with smaller employers, they may not. I would say the usual challenge that we find with a smaller employer is that there is one person who has to do a lot of things. So one person has an HR responsibility, a labor responsibility, and potentially an absence management responsibility. But it's no different. I'm coming off of working with a manufacturer of 160 people in Oakville. And really the focus for that group was they had a raging absence problem, and it was really more focused on good language, consistent implementation, and education of their supervisors, because there was none of that. So it really shines a light on how different size employers have different problems. But what unifies them all is that first state of understanding where you are clarifies what that employer's issues are. This is not a template. Our answers don't apply to the same organization the same way. So we work with a bulk of smaller employers, and last group we work with, both Allison and I could share, is again a small manufacturing outfit. And really what the benefit of this is, you can quickly implement in a smaller organization than you can in a large organization. So we much prefer quicker implementation and quicker results. So that's how I would tackle that question. Oh, I think, Allison, we got you on mute.
I'm trying to type responses in, so I don't want my clicking to, I'm going on mute and off mute. Thanks, Angelo.
Yeah.
This was related to one of the questions that you had put in your poll at the beginning, and that was around, is it a strategic priority for your firm? And the question was around policy. Like, policies are often, that's carved in stone. That's our benefit plan. That's our policy around absenteeism. How do you then raise what is considered a cost of doing business to a strategic priority in the organization? How do you get the attention of leadership? How do you get
good question. We so find that a lot of organizations, large and small, they bury absence management. I guess they bury it inside of a task in an organization. And remember, is when employees are at work, they are treated with respect by their peers, but there's a negative stigma attached to when they go off work. We really test and ask a question: how do you actually engage an employee when they're not at work? Because that's when they need you the most. What are you doing to engage them? And unfortunately, we find sometimes as well, we don't really call them if they're off. We don't want to harass them because there's a perception that the call is to, why aren't you at work? And what's wrong? And validating it on the phone, where we really frankly want to understand the room for that call to an employee that sounds more like, hi, Joe, know that you're not here today. Wondering if we can do anything to help you. Yes, we'll help you with the attendance issue, but I just want to make sure you are okay. Attendance is always perceived as negative. And really, that's an opportunity for us as organizations and leaders in an organizations. Employees need us the most, especially when they're in trouble. And that turns into an absence. So, it's really turning the view of how absence management is implemented. Again, that's what comes out in that assessment phase is, we look at employee surveys, and unfortunately we've seen some nasty ones around, my employer doesn't care for me when I'm off work. They don't even talk to me. And that's an opportunity for an employee to really help with culture and morale if we're including that as part of our workflow and attendance management.
Great. We're also looking for a little direction, Angelo. When you think about group benefits, which obviously many people on the call, that's the primary focus of reviewing group benefits. And some of the things that are happening in the landscape today, COVID being one, which highlighted this, mental health claims are becoming more complex. Mental health is impacting workers' compensation. For groups, when they're looking at their group benefits, how big a part of absence management review is the group benefit program, and what is required there to help support better attendance? What's the connection?
Yeah, great thought. Yeah, I mean, that data is so valuable. There's two data sets that we look at when we assess an attendance program. One is the absence program, the benefit itself, depending on how you've structured it. And if it's an insured program, there's a lot of great data on what kind of absences, musculoskeletal, mental health, incidents, et cetera. The other is usage of benefits. And overwhelmingly, the third piece of really good information, if an employer has it, is wellness information. Some organizations have some form of an employee assistance program. Those three data sets really provide a picture of what ails an organization's employee base. What I will say is, depending on what industry or organization it is in, if it's highly manufacturing, high functioning type of roles, you may get a lot of workers' comp and MSK exposure across all those data sets. But I think when you do an absence audit, it's critical for us to understand what they're using from a benefits perspective. So what medications are being used, which provides us with what kind of ailments. But a lot of it doesn't change across employer types. because the one big growing problem is mental health in the workplace. And you're going to see it in the cost of people being off work. You're going to see it in the drugs they take, and you're going to see it in their wellness programs on utilization. So I would say the best way to bridge the gap in the question is, one, is it's a very important part, and we do include that understanding as part of our assessment. But two, is what we do with that data is feed in and build programs like wellness that actually tackle what ails your population versus just picking I'll take a category 1 wellness program. Is we really want to make sure wellness programs are well utilized. And that's the preventative side of a strategy.
Thank you. Last one, it's the last question I have for now, but I see that there's somebody else in the chat box. I have a question around challenges or roadblocks. And when you are working with organizations and, small, mid-sized, large organizations, and coming up against the roadblock of just initially tracking absences, what do you do when you don't have data, when you actually haven't been measuring, and to start an audit, you're asking all of these questions that were outlined. What do you do if you haven't actually been tracking? How do you get past that roadblock?
Yeah, good question. We've seen it before. Usually what is tracked, because it has to, is payroll information. So we have to use what we have. And when there is an absence of absence tracking and measurement as an initiative on its own, is we first start with, well, what do we have? And we always know we have payroll information. As it may not be accurate data, but it's generally a good start. So we're able to pull some information from an organization, and that information really helps us with initial costing, and it answers the fundamental question of how are we doing amongst our peers? Because if we're doing okay, then the plan is different than if we're on fire and our absence rate is really impacting our goals. It really depends on the plan we create. But in all cases, I go back to fundamentals, is if you're not measuring something, then you're not managing it. And if the bulk of an organization's investment and cost is payroll, this is the first business case we try to implement at a real direct level to say, well, we first got to measure it. I think you can't get around not having something that can't measure this matter, because it's so important. And there's many different ways. There's so much out there that can be easily done. And I'll share with you, we helped an organization. It's a small group out of Guelph. Same problem, didn't have just accounting records, no HRIS, no. And what we did at a very, very low cost was software as a service, absence software. I think it was less than $2 or $3 per employee per year, per month, or something like that. But a very, very, a real small investment in beginning to track this thing. And then it like a rose, flourished. It began to say, wow, look at the size of what we're dealing with. We really need to deal with this matter. So that's how I would deal with an organization that may not have anything. Well, we know you have something, and that's where we should start. And really, it's important for us to start thinking about the different ways, short-term and long-term, of how to fix that measurement and tracking issue.
Great, thank you. Angelo, with respect to, there was a couple of comments around mental health, and we know it brings complexity. We know that it is challenging to case manage, and we really know it's very challenging to get the supports and services to employees. Can you talk to a little bit around how you can support complexity of claim, especially in organizations where those teams are limited, right? They're small teams, they may even be outsourced.
Yeah, good question. Really good question. I'm going to first start and say every organization is not immune to one. It's currently a recommendation that will become a requirement by every form of government that they have to have a position on mental health in the workplace. And that position right now, you're starting to see it in legislation. So it's almost like a warning sign that there's more legislation coming that forces employers to have more structured programs around mental health in the workplace. And that certainly, that program really deals with two things. If you need help and support while you're at work, and also what does that support look like when you're not at work? So it's not just about we have a worker or we have a mental health absence issue and we need to deal with it, because that's a tactic. So I'm going to just broadly answer the question in saying, right now, organizations need to have a position on it, which means a policy, be prepared to have things like open forum and people trained in mental health first aid. This is kind of what we're seeing as obligations employers need to start thinking about. But when it comes down to the person who has a mental health issue, is either at work on some sort of accommodations or maybe off work, it's really, really important as a tactic to make sure that medical professionals are dealing with medical professionals, because I want to dispel the myth again. Mental health perception, well, I feel stressed, so I need to be off work. And that comes up quite a bit, not all the time, but it comes up quite a bit. And what we first want to do is to first medically evaluate, are you stressed? Because that's not really a diagnosis. Or do you hate your job, your boss, your shift? So we separate the issue. But then what's delicate, if there's an actual medical validity to this, it's all around how we support and reintegrate that employee from a case management perspective, whether it's done inside the organization by the employer's staff or whether it's outsourced. Nonetheless, that delicate reintegration needs to ensure that we're managing the reentry and reintegration plan with that person's rehabilitation on that condition. So it's a highly sensitive thing and it's a highly specialized thing. And if that expertise exists at an employer site, great, we evaluate it to make sure it's working well. If it doesn't, then get the experts in on that.
Perfect, thank you. So maybe just in the last few minutes, Angelo, we brought up that three-phased approach, and the front end, we talked about the audit. And, we have that quote from the Hamilton Wentworth that said, bold undertaking, and, what was required. Can you just take a moment to say, if we're looking at this and we realize, yeah, we'd like to get an understanding, what's that experience like? Where do you start, and what does an audit do? Yeah. How do you conduct it?
Sure. So I would say, I'm going to put some time frames around this to give it some weight and clarity. Is an audit in our world, it takes about a month, about 30 days. And that audit is interviewing your staff, looking at your data, looking at your policies, looking at actual cases you have, and then looking at your financial information. So I would say it's about 30 days in duration. So it's a quick start. And what that involves is a critical feedback report back to the organization saying, here are your gaps, here are recommendations. Part two of this is once organizations get an audit, it's like, well, what are we going to do with it? How are we going to implement all these things? When are we going to implement it? How much is it going to cost? Well, that's where step two comes in. And that is an interactive process that we take in the case of the Hamilton School Board, took about 60 days. So about 2 months, because it was iterations of essentially a business case that the organization need to make and saying, if we want a half a day reduction over a 5-year period, we expect certain returns from that, but we also need certain investments in that. So we built the business case, came up with really good management tools like Gantt charts, areas of responsibility, funding, and ROI for approval to the organization to say, yes, we're going to bless this work because we want that result, which allowed us to then implement. Implementation, in our view, ranges from a year to 18 months, typically. We don't want to be a fixture inside of an organization, so we want to come in, help you implement, develop the right habits, ensure you're getting the results you want, and then we back out slowly. So I'll give that as a response as we're coming up to the hour of the typical timeframes and I say deliverables with an engagement of any employer, large or small.
Thanks, Angelo. I think, I don't know if you have any closing comments, Angelo, before we hand it over to Allison to close us
I
out.
will. My closing comments are very short and sweet. Is if today's presentation did anything, is look at this thing strategically. Is stop with band-aids. They really worsen the problem. 2 is think about this framework as you think about tackling absenteeism. Is have a good framework that'll get you long-term sustainable results. I think that's the 2 things that I think are important takeaways. And certainly, the last part of what I would say is a gratitude of thanks to every employer that's struggling with this issue, because it is so critical to do this well in order for your company to be successful. You really have to do it well. Our mantra is we want you to do it well, do it right the first time. Don't go through that. Don't go through those band-aids and hurt your organization and delay progress. So just a gratitude of thanks for everyone listening in on this. And hopefully you've gotten something to walk away with. And lastly, thank the Leslie Group for having us talk to you about this really, really important issue. So those are my parting comments. So thank you, everybody.
Excellent. Thanks, Angelo. Really appreciate you sharing your expertise today. And I know for me, sitting through the presentation, my big takeaway is, as employer dealing with lots of different employer groups, it's so easy to get caught in the Band-Aid solution and really just dealing with the symptoms. And to me, the takeaway is we need to take a step back and look at it from a holistic standpoint. So we can really look at, okay, this is the symptom, not the problem.
Yeah, you know what? I'll say I like using the medical analogy. If you think your arm's broken, the first thing you do is don't put a cast on it, is you get an x-ray. And that assessment process, just thinking about undergoing that, is the most critical part of this. Get an x-ray. Get an x-ray.
Absolutely. Yeah, get all the information so you can make educated, strategic decisions.
Exactly.
Thank you. Thank you to our two other panelists, Bill and Allison, for joining us today. And a huge thank you to all our attendees. I know everyone's time is valuable. Part of the reason that we chose today's topic was feedback. So we got feedback from previous attendees that this was a topic that was certainly timely and of high interest. So I would encourage you to also pass along other topics you want to hear about. So we are trying to do webinars at least once a quarter, and a lot of that is based on topics of interest. So if you have anything that you do want to hear about, please reach out to your Leslie Group consultant, because we're just in the process of doing our planning for 2022. One last housekeeping item is the presentation today. Both the PowerPoint and the recording will be posted on our website. So it'll be up there next week. So if you do want to reference any of the material, that will be available. And again, a big thanks to everyone for your time this morning, and especially you, Angelo, and your team.
Thank you very much, everybody. Good luck, and speak to you all soon. Thank you.
Great day. Bye-bye.